Today we'll be continuing our study of Titus 2, 4, and 5's instruction that we love our children, this time with regard to arming ourselves against needless and harmful interventions from the medical system during our pregnancies. Hello, and welcome to Wisdom for Women, where we study the Word of God and the words of God, applying them practically to our daily lives, our habits, our decisions, our personalities, our work, our play, and our relationships. This is a gender-specific channel for women. 1 Timothy 2:12 says, "But I suffer not a woman to teach, nor to usurp authority over the man, but to be in silence." At the same time, I'm commanded as an aged woman to teach the young women. In light of that, let me make it clear that if you are a man viewing this episode, you should know that my teaching is not directed toward you. Today and every day, I'll be reading from the centuries-old Authorized King James Bible, the perfectly preserved English translation of the very words of God, and we will together study to show ourselves approved, workwomen who need not be ashamed, as we rightly divide the word of truth. Let's get right into the scripture. Titus 2, 4, and 5, that they, meaning the aged women, may teach the young women to be sober, to love their husbands, to love their children, to be discreet, chaste, keepers at home, good, obedient to their own husbands, that the word of God be not blasphemed. We're on the topic of loving our children, and so far we're studying how we can best do that while they are still in the womb. In today's episode, we're going to look within the medical system of this world, and specifically at some of the landmines you may and likely will encounter if you choose to start down the road of navigating the medical system by signing up for prenatal care. If you're an average American woman planning a hospital birth, consider these statistics from Janice Barcelo's Birth Trauma and the Dark Side of Modern Medicine. The United States has a higher infant mortality rate than any of the other 27 wealthy countries of the world. A baby born in the US is nearly 3 times as likely to die during her first year of life as one born in Finland or Japan. That same American baby is about twice as likely to die in her first year as a Spanish or Korean one. Despite healthcare spending levels that are significantly higher than any other country in the world, a baby born in the US is less likely to see his first birthday than one born in Hungary, Poland, or Slovakia, or in Belarus, or in Cuba for that matter. These incredibly high death rates are a direct result of medical interference in the birth process, which results in 90% of all babies being born in the US with some type of drugs in their system. None of these drugs have been tested for safe use in infants, and all of them have the potential to create long-term problems in children, including difficulty with maternal-child bonding and drug addiction later in life. Barcelo advises, and I agree with her 100%, that you stay home to have your baby, just as you likely stay at home for any other normal biological process in life. Birth is not an illness, any more than the marital act which facilitated the pregnancy and birth is an illness. And when we treat normal biological processes of life as if they need professional oversight and intervention, we necessarily add complications, snags, difficulties, and risks. Barcelo asserts, my strongest advice to birthing families is to avoid going to hospitals whenever possible, and gives serious consideration to birthing your babies at home. Studies now show that home births are safer than hospital births, and the number of home births in the United States has risen by a whopping 41% in just 6 years. This huge jump in home birth families is no doubt the result of parents having either experienced major trauma during a previous hospital birth or simply doing their homework to discover what is actually happening in U.S. hospitals. The cesarean rate for midwife-led planned home births is a low 5% compared to nearly 33% or more in U.S. hospitals. In one large recent study of almost 17,000 planned home births in the United States, it was found that 97% of the babies were born full term, as opposed to almost half of hospital-born babies being induced prematurely. And 87% of previously C-sectioned moms had a successful VBAC at home, a vaginal birth after cesarean. Compared with the relatively low-risk hospital group, intended home births were associated with lower rates of electronic fetal monitoring, 9.6% versus 84.3%, Episiotomy, 2.1% versus 33%. Cesarean section, 3.7% versus 19%. And vacuum extraction, 0.6% versus 5.5%. Still another study, which examined every birth in the Netherlands over a 2-year period, found that home birth is safer than hospital birth, and that those who opted for hospital births were 1.8 times more likely to suffer severe morbid events, 2.3 times more likely to end up in intensive care, 2 times more likely to suffer eclampsia, 1.47 times more likely to suffer multiple blood transfusions, 1.3 times more likely to suffer from postpartum hemorrhage, 1.44 times more likely to require manual removal of the placenta. The fact is that modern medicine's push to medicalize all births has never been based on what's best for either mother or child. This Netherlands study included all births for a span of 2 years. How much more is required to prove that natural is generally better? One of the Cochrane collaboration's celebrated reviews found that birth is less safe in hospitals. Modern medicine's most routine intervention, early cord clamping, steals a third of a baby's own blood, and it's done in nearly every birth. Yet the push is to move every single birth to a hospital, to destroy this most sacred of experiences and cause an amount of harm that is nearly inconceivable. Indeed, the amount of harm being caused by hospital birth truly is inconceivable, which is probably why so many people have avoided looking closely at its effect, lest they be forced to examine their own compliance with this system and the resulting pain it has caused them, their families, and/or their clients. While we're at it, let's not forget how destructive the medical system is across the board, even outside of the obstetrics ward. Again, this is from Barcelo. A group of researchers meticulously reviewed the statistical evidence, and their findings are absolutely shocking. This fully referenced report shows the number of people having in-hospital adverse reactions to prescribed drugs to be 2.2 million per year. The number of unnecessary antibiotics prescribed annually for viral infections is 20 million per year. The number of unnecessary medical and surgical procedures performed annually is 7.5 million per year. These are millions we're talking about. The number of people exposed to unnecessary hospitalization annually is 8.9 million per year. The most stunning statistic, however, is that the total number of deaths caused by conventional medicine is an astounding 783,936 per year. Just so you know, these are called iatrogenic deaths, and they are the third leading cause of death in the United States. 783,936 per year. Back to Barcelo. It is now evident that the American medical system is the leading cause of death and injury in the U.S. Moreover, the word pharmacy derives from the Greek word pharmakeia, which means sorcery. Pharmakeia, sorcery, is a form of the Greek root from which we get our English words pharmacy, pharmacist, and pharmaceutical. The learned William Barclay says that pharmakeia began to, quote, denote the misuse of drugs, that is, the use of drugs to poison and not to cure. In the New Testament, pharmakeia carried with it the idea of sorcery, occultism, and black magic. It's certainly something to consider, my sisters and daughters. I would bet if you sit down with most mothers who have given birth within the medical system, you would hear horror stories, one after the other, whether the mothers realize they are horror stories or not. Sometimes, particularly naive women have been indoctrinated enough by the system that they regard their doctors and nurses as saving the day during their deliveries. These fearful women view birth as a disease or illness that needs medical help. They do not see pregnancy or childbirth as a normal biological process like eating, eliminating, having a monthly cycle, or enjoying sex with their husband. And yet I wonder if they would invite and trust professionals to oversee any of those other normal biological processes. I know I certainly wouldn't. Anyway, for these fearful women, when a doctor puts them on Pitocin, or vacuum suctions their baby out of their uterus, or breaks their water, or cuts them open for a C-section, well, to them, that doctor is a hero, a rescuer, a savior of the birth. Many women also feel this way about the anesthesiologist who gives them their epidural and takes away their pain. I'll explore the very dark side of epidurals in the next episode, but for now I can't help but remember the friend of mine who got her epidural and then in response kissed the male anesthesiologist because of her relief. What a strange and inappropriate response from my friend. There in the same room was her beloved husband, the father of the little one she was about to bear. But instead of leaning on him for support as she labored, she turned to reliance on a professional and suddenly transferred her affection to him when he offered her relief in the moment. I have since heard of other women who treat their anesthesiologist similarly when he magically relieves their labor pains. This reminds me of one of the quotes from Dr. Mendelsohn, which I mentioned in our last episode. If you missed that one, I'll link it in the description. He said, unlike business transactions, which are characterized by an exchange of commodities, professionals give themselves in the performance of a service in return for a fee. More often than not, that service is one which ideally would be performed by a family member, friend, or by the person himself. In professions, the prostitute replaces the wife, as the doctor replaces the entire family. The weaker the family, the greater the opportunity for professionals. In the case of my friend kissing the anesthesiologist, all I can say is that she had mixed up which man in the room she should be relying on, and had replaced her husband with a professional who gave her a dubious service in return for a fee. Other less naive mothers who have birthed within the medical system will have seen behind the curtain of modern medicine, and they will now realize the horror of their own birth horror stories. They will, in retrospect, be able to insightfully narrate the cascade of interventions that led to complications that required more interventions, and they will be able to make correlations between their own and their baby's birth outcomes and those interventions and complications. These women will have wised up and are on the alert in future birth scenarios. A discerning mother with retrospective insight will be a difficult woman for the medical system to fool again, unless they can scare her into submission when she is most vulnerable during her next birth. And they will try to scare her into submission because any woman who sets foot in the labor and delivery ward of a hospital armed with facts, experience, and a strong support system of her own will necessarily be viewed as a threat by the professionals who are used to getting their own way. She will likely be faced with anger, hostility, threats, intimidation, and even vengefully destructive acts by doctors and other medical professionals who are thwarted by a woman who refuses to bow to their system. My advice to you, my sisters and daughters, is first of all to give birth at home. But if you find yourself needing to be in the hospital, to arm yourself with all the facts, with all your rights, with an excellent support system, and with a cool head, and then to confidently assert yourself within the hospital setting and not to be afraid to walk away, even against medical advice, if you are unhappy with the care being offered and want to do something different. The doctors and nurses and anesthesiologists at the hospital are not God. Do not treat them as though they are. They are your servants, whom you are paying. If they attempt to force a service onto you which you do not want, you are free to say no. And if they attempt to threaten or intimidate you, your husband, or your baby, you need to push back calmly but forcefully with your rights and even with legal protection, something we'll delve into more deeply in the next episode. Barcelo advises parents thus: for those who are courageous enough to step away from this madness and choose home birth, there are a few very important things to keep in mind. Number one, there are forces in the United States that are extremely antagonistic to families that choose to birth outside of the system. These very dark forces that often operate through medical personnel and CPS have been known to take radical action against holistic-minded families, even to the point of having children kidnapped and taken away from their parents. Young children have been placed in the custody of strangers and/or the medical system itself for very flimsy reasons, and sometimes the legal system upholds this evil. It is imperative for parents who are considering home birth to have a healthy respect for the medical and legal apparatus that can be mobilized in an instant should they, the parents, seek support from medical people of any kind during or after a home birth. It is wise to prepare well in advance for an emergency with a list of naturopathic, chiropractic, homeopathic, osteopathic, and/or truly friendly allopathic support should you need it, and thereby avoid negative attention and intervention from unwanted antagonists in the medical field. Of course, if you feel you need to go to the hospital, you absolutely should without a doubt. In the event this becomes necessary, it is wise to have a lawyer at the ready should the people at the hospital decide to give you any trouble. On pages 73 and 74 of Barcelo's Birth Trauma and the Dark Side of Modern Medicine, we read, if parents dare to question the dictates of the medical system, or if they seek to make their own determination about the care of their newborns and protect them from medical assault, doctors and nurses can turn against them like rabid dogs, calling in child protective services and instigating the kidnapping of very young children. Some of these children are literally held captive at American hospitals for weeks and months. Okay, before we talk more specifically about our rights as patients, which we'll do in the next episode, let's today take a quick peek into normal prenatal protocol within the medical system and why you should be leery and suspicious of any intervention a professional tries to push on you. First off, if you choose to go through pregnancy and birth within the medical system of this world, you will be making regular visits to a doctor. On your very first visit, when you are in the first flush of excitement and happiness about this new little one on the way, you will be ushered into a room and instructed to remove your clothing and don a one-size-fits-all smock that is completely open in the back. The doctor or nurse will check your weight, your height, and your body mass index. Then the doctor will discuss your diet, your exercise routine, and maybe even your sex life, and will suggest that you go on a prenatal vitamin. He may also suggest genetic screening to test for Down syndrome and other fetal abnormalities. He will give you a blood test to confirm your pregnancy and to check for all sorts of blood disorders and problems. And he may also want to check for blood incompatibility between you and your husband. You will have to give a urine sample so he can run a complete urinalysis. Then he'll do a pelvic exam, feeling around with his fingers to check for herpes lesions, even if you assure the doctor that you are herpes-free. And he will swab your cervix and send the results to the lab to check for more STDs like gonorrhea and chlamydia, even if you insist that you do not have an STD. Doctors never believe their patients. He will also probably do a breast examination, though why he will do this is completely unclear, just looking for lumps and problems. The doctor will not accept you reporting to him that your breasts are completely fine. As stated previously, doctors never believe their patients. After he has fondled and probed your body and taken your blood and urine, he will want to talk about your menstrual cycle, any other births, your personal and family medical history, whether you feel safe at home, whether you drink, your history of drug use, whether you have traveled to what the medical system deems are dangerous areas of the world, and if you have had any toxic exposures. And then the doctor will order a 20 to 30-minute ultrasound scan of your baby. If you're in the early stages of pregnancy before 12 weeks or so, he'll probably want to do the scan through your vagina. But if you are further on, he'll likely order an abdominal ultrasound. And that will be your first appointment as an expectant mother. But let's just take a minute and unpack what all actually happened in that first visit with the professional who is now taking charge of what would have been a normal biological process. First, you had to strip off your everyday clothing in order to wear the most demoralizingly unattractive garment in the history of the world, a patient gown. Then you'll need to be weighed and measured, which for many women is extremely stressful, as their bodies are judged according to medical charts and supposed science, and as the women are advised perhaps to exercise more, or to watch their diet, or to eat more or less than they have been eating. So you will already feel from the very beginning that your dignity, your modesty, your personal autonomy, and your privacy have been relinquished to the professional authorities for their inspection and judgment. Next, you'll have to give blood and urine to be tested for all sorts of scary diseases and irregularities. The physical acts of being pricked with a needle and urinating in a cup are out of the ordinary enough that there will be a mild alarm in your central nervous system already. But on top of this, there will be the underlying fear that you may actually be one of those who has a scary disorder, that you might be the one in 100,000 who has sickle cell anemia, that you might somehow have contracted hepatitis B, or not be immune to German measles, or that your baby might have Down syndrome, or whatever else the doctor might mention being concerned about. You are now being measured by your physical body, which is regarded quite dubiously and suspiciously by the professionals, and certainly not trusted to be normal and healthy. Nor are you, as a woman, to be trusted by the professionals. No doctor will cancel his lab work and his examination of you simply because you assert that you are healthy and fine and would like to be left alone. No way will he believe that you couldn't possibly have an STD because it's only ever been you and your husband together. No, you, the patient, are doubtful, untrustworthy, and suspect, and your body is fundamentally unreliable. Also now, as a patient, your marriage is under the microscope, and your husband is called into question and suspect and untrustworthy too, in the professional's opinion, even if you assert to the nurse or the doctor that you do feel safe at home. At your core, even if you cannot put it into words, you understand that this is a system that does not believe you and does not honor your marriage or your husband, and does not believe that your body is capable of a normal, healthy biological process. You may feel uneasy that your entire personal medical history, which you would never tell to another brand new acquaintance, has now been laid bare to be scrutinized and judged by these professionals. And there will, no doubt, be a layer of insecurity and embarrassment added to your mental and emotional state after you have been coerced into revealing all of this information. So if you are given a moment to self-reflect, you may realize that your mental and emotional state has officially shifted from the excitement and anticipation you felt when you saw those 2 positive lines on your pregnancy test into an uneasy state of low-level anxiety and trepidation. Wow. Pregnancy is bigger and scarier than you ever thought. And then you'll get to hop up on the table for some physical intrusion and violation, all because you are not believed about your own health, and the doctor has to make sure for himself. You will not have been informed that you have the right to refuse this intimate invasion of your privacy. You'll simply be expected to comply. So there you will lie, perched on the table, with your legs up in stirrups so the doctor can have a great view of you and can feel around for lesions before he inserts his speculum and a swab inside you to get data off your cervix. And then, or maybe before this, he will palpate and fondle your breasts for as long as he needs to supposedly check for lumps or abnormalities. If this were any other person in any other situation in life, you would never stand for it. If another stranger coerced you to remove your clothing and don an undignified, unattractive, immodest gown that's completely open in the back, and then asked you intrusive and personal questions, coercively weighed and measured you, gave you arbitrary directives as to your personal diet and supplementation, extracted your blood for analysis, collected your urine in a cup for scrutinization, scared you with highly unlikely disease and disorder catastrophizations, questioned the kindness of your husband and the peacefulness of your home life at large, refused to believe any of your assertions about STDs or your general health, showed suspicion and distrust of both your body and your mental competence, and then coerced you up onto a table and exposed your most private sexual areas for his personal viewing and groping, you would exit the situation ready to call 911 and get this intrusive, psychopathic, perverted predator locked up in prison. But by this point in your initiation into the medical system, you're going to be so destabilized by all the jargon, the clinical concerns, the implicit catastrophizations, and the obvious hierarchy that you'll probably have forgotten that just an hour or so ago you were a confident, autonomous woman with God-given reproductive organs designed to function normally in order to bring life into the world. I have personally watched the strongest, healthiest, most confident women I know bow before the pressures of the medical system and allow unthinkable invasions to their privacy and negations of their and their baby's rights. And all I can say is, congratulations to the medical system for successfully scaring, pathologizing, and subordinating these women, their husbands, their pregnancies, their labors, their deliveries, and their babies. Back to the doctor's office. At this point, after you've submitted to your pelvic exam, your pelvic violation, the doctor might send you home, properly chastened, with instructions about your next appointment. Or he might go ahead and squeeze the initial ultrasound or scan into the mix. The ultrasound, he will say, is just so the medical system can declare when your due date really is. Because remember, doctors never believe you. And your own personal calculations could not possibly be true. Nothing is ever true until it comes out of the doctor's own godlike lips. And the ultrasound is also that he can be sure baby is doing fine and rule out abnormalities, twins, triplets, and the like. He can even, like God, tell you the sex of your baby if you want to know. Depressingly, even if you choose to wait and be surprised, you'll still know inside that he knows. And knowledge is power, a concept that even if you still can't put it into words, will just be one more piece of egomaniacal power stacked in his favor and against yours. So you'll get to be up on a table again, either with an intrusive and violating transvaginal ultrasound wand stuffed up inside you for the next 20 to 30 minutes, or with your belly smeared with KY jelly and the wand poked all over your lower abdomen for those 20 to 30 minutes. And what neither the doctor nor your ultrasound technician will tell you is that for the whole 20 to 30 minutes or longer, that machine's wand will be emanating high-pitched ultrasonic wave frequencies as high as 100 to 120 decibels. I'm reading now from another of Ginny Sparcello's books, The Dark Side of Prenatal Ultrasound and the Dangers of Non-Ionizing Radiation, from pages 9 and 10. As the ultrasound beam moves during examination of the fetus, the focal point of the beam can pass over the fetal head. When this happens, the sensitive hearing structure of the fetus receives vibrations at a rate equal to the number of pulses per second from the ultrasound beam. The radiation force of these vibrations produces a localized noise that might range from 85 decibels to 120 decibels if it were traveling through air. Etzel and Associates found studies suggesting that exposure to excessive noise during pregnancy could result in hearing impairment, prematurity, and IUGR, intrauterine growth retardation. Acoustic wave pressures allowed by the FDA for diagnostic examinations are 200,000 times the human hearing pain threshold. Let me read that to you again. Acoustic wave pressures allowed by the FDA for diagnostic examinations are 200,000 times the human hearing pain threshold. Barcelo goes on to say, indeed, the children are being electrically jolted by the technologically manufactured frequencies, which, in addition to being harmful, are also extremely loud and disturbing. Studies confirm that developing babies tend to increase movement when exposed to ultrasound, and researchers believe this is because the noise is audible, not to mention that ultrasonic irradiation can cause extreme heating and can make babies feel sick. A tiny baby in the womb cannot escape this torture that goes on for 20 to 30 minutes and sometimes longer. But your doctor and your ultrasound clinician will not worry about the baby's comfort. They're only concerned that they get the procedure done, get their money, and maintain their godlike status in your eyes. Now that you have been undermined, humiliated, and chastened into proper, fearful subservience to the doctor and to his medical system, and now that your tiny baby has been tortured and scrutinized by the same, your indoctrination is mostly complete, and you will likely comply with anything the doctor throws at you through the rest of your pregnancy and during your labor and delivery. Amniocentesis? Why not? Doctor knows best. Internal fetal monitor into the scalp of my baby? Sure, if you think so, doctor. Stripping my membranes? Breaking my waters? A pit drip? Epidural? Suctioning my stuck baby? A C-section? Of course, doctor. Whatever you think is best. The system has effectively humiliated, demoralized, and ensnared you, has caught you in its fearful, dehumanizing clutches, and you have resigned your personal autonomy and confidence in your own God-designed reproductive capabilities, and you've handed your free will and self-determination to a system that operates on the strong belief that pregnancy and birth are not natural biological processes, and that, as Dr. Robert S. Mendelsohn said, anything that can be done will be done. We're going to talk about birth interventions and complications orchestrated by the medical establishment next time, but right now I just want to encourage each of you, my sisters and daughters in the Lord, that there is only one important, specific, intentional action that you need to take as soon as you discover you are expecting a baby. That intentional action is to intentionally not do anything within the medical profession. Do not get yourself set up with an OB/GYN and prenatal appointments. Then you are in their system. Do not even get yourself a nurse midwife or registered midwife. These women, by virtue of their qualifications, have placed themselves under that jurisdiction and restraint of the medical system and can only operate within that. If you feel you have to have outside support for your prenatal and birth care, look for a direct entry, a granny midwife who has not received certification and who shares your same values. Having this sort of a low-key, hands-off direct entry or granny midwife can also quiet nervous relatives and friends who might otherwise actively worry and catastrophize your situation. But if you and your husband wish to do this on your own and you can keep a low profile, human history proves that it is possible for a woman to deliver a strong and healthy baby without the drama and fear of the medical world. You are here on Earth because women for millennia have successfully done just that. Keep that track record in mind as you consider your birth options. But for now, early on in your pregnancy, why not just rest in the Lord and thank Him for this new little life and stay away from the doctors? Eat good, healthful food. Go for walks in the sunshine and breathe fresh air. Love your husband. Love this tiny new life starting inside you. Fill your mind and your heart with the Word and the words of God. Pray for your tiny baby and enjoy each new sensation of its aliveness within your womb. Read up on natural childbirth, natural remedies, and how to take charge of your own labor and delivery. Talk to your husband about your thoughts and ideas and listen to his. And think about the money. Did you know that according to wise.com, the average hospital birth, even with full insurance, still will cost you $3,400? And if you don't have insurance, it ranges from $30,000 to $50,000. But if you don't bother with the intrusive, dehumanizing, expensive professionals in the medical system, you can keep that money in your bank. Or maybe you can spend that money on something way more fun, more productive, or more needed in your life. Maybe you could set aside that birth money to be spent as a trip with your new baby after your money-free home birth. Maybe that money could go to some house repairs or toward a new vehicle or more high-quality food or anything other than the ravenous beast of a medical system that doesn't care about you, your husband, or your baby. We'll talk more about patients' rights next time, but for now, if you do find yourself forced by emergency to go to the hospital with your pregnancy or delivery, please know and acquaint yourself with the Patient Self-Determination Act. This is a federal law in America. According to the website Caring Info, which I will link in the description below, quote, the Patient Self-Determination Act, PSDA, is a law that was passed in 1990. The PSDA reaffirms the common law right of self-determination as guaranteed by the 14th Amendment of the United States Constitution. Basically, this means that you, as the person receiving care, have the right to make choices and decisions about the type of medical care and the extent of medical care that you would or would not want. So you know, the Patient Self-Determination Act allows you, as a patient, to say no to procedures, surgeries, medications, and other interventions, and it allows you to leave the hospital, even against medical advice. I personally have declined procedures and have walked out of a hospital against medical advice. And I would encourage you to be brave and do the same if you do not wish to pay for the service being pushed on you. You will only understand your rights when you assert your rights. And be certain that you behave calmly and rationally when you do assert those rights, so that hospital personnel will have no excuse to restrain you by force. Last episode, I reminded us all that we are in a war from preconception on for the minds bodies, and souls of our children. We mothers have been handed a clear spiritual and physical directive and entrusted with eternal souls to guard, to guide, and to train in the nurture and admonition of the Lord. We need to go into this battle ready for our task, confident in our abilities, and skeptically mistrustful of any system of this world that asserts that it can do our job better than we can. And that includes the medical system. Thank you for joining me today, my sisters and daughters in the Lord. Please tune in next time as we talk about loving our children through labor, delivery, and knowing our rights.